We are here for another episode of Homefront. This is season 2, and as we said, we're going to be diving deeper into some of the conversations. And today we are going to speak with someone who was affected by COVID-19 when it comes to the household. So we know we will have touched on many different issues affecting all of you guys in terms of the pandemic, and myself included. And now we have someone to give us a first-hand view on this entire pandemic and how it would have affected them. So I want to welcome to Homefront Mr. Cumberbatch, who is an estate sergeant. Welcome, Mr. Cumberbatch.
Thank you, sir.
We have JP as usual with us.
Hi, Remy.
Hi, JP. Thanks for joining us once more on Homefront. So, Mr. Cumberbatch, let me dive in a bit into this episode where we're talking about how the pandemic affected all of us at home. So, how did the pandemic affect you?
Well, the pandemic reached into my home where I lost my wife of 33 years.
Wow.
1 week after she was diagnosed, she passed away.
1 week, so quickly.
Yes, it did. Also, my eldest son, he got it along with my wife, and now he has renal failure.
And that's kidney failure.
Kidney failure.
So, it's you in the household. So we want to paint the picture for the audience because we're trying to kind of understand how this pandemic really would have affected a lot of us. And with you said that the COVID-19 virus entered your home. So the household would have consisted of who exactly?
My wife, myself, my eldest son, my second son, my daughter, and my daughter-in-law.
So your wife would have been the first person to contract the virus?
This year, yes. She contracted it around the same time my son. They went out the day of my birthday, you may ask, to surprise me, and a couple of days after, they came down with flu-like symptoms. We carried them to the Shogunas health facilities, and the day after they were confirmed COVID-19 positive.
So what about the other people in the household?
We all were tested. My son and myself were negative. My daughter and my daughter came back positive.
Right. So then we're going through this process now. So your wife and your eldest son, they come back positive. What happens next?
Well, that was the Monday. The Tuesday, my son was transferred to Arima Hospital because they said he had to do immediate dialysis. The Wednesday, my wife was transferred to the Couva health facilities where she stayed until her demise.
Now, in terms of, all right, we're getting a bit personal with it now. How would that have affected the rest of the family that week when you all got this news?
Well, we first started off by coming together and praying 3 times a day. It brought us closer together. We never lost hope. And it was a bit traumatic for us, but it brought us closer together. We prayed up until the last. But God knows best. She's in a better place. My son is improving and getting better. But it has drawn our relationship with one another a lot closer.
So your son is still in the hospital at this point?
No, he's out.
He's out now?
After 33 days.
Oh, 33 days in the hospital?
33 days.
Wow. At any point in time when your wife contracted the virus, did you all think that she would have died from the virus?
Never.
No.
Never.
So you all had the hope while you were praying?
We had hope. We had faith. But God knows best.
Right, right. So that news, did it come as a shocker to you all, or did you all, leading up to her final days, did you all think?
Well, she went in on the Wednesday. On the Saturday, I got a call stating that she was unresponsive. And they wanted to do a CT scan on her. And the Saturday evening, 4 o'clock, they called and they said, well, it was a massive stroke.
I'm Dr. Osafo Fraser, County Medical Officer of Health for County St. George East. Yes, the COVID-19 vaccines work. Based on the research conducted in many countries globally, we know that approved vaccines significantly reduce your chances of both getting and spreading the virus. Even if you do get COVID-19, the vaccine is effective at preventing you from getting very sick, ending up in hospital, and dying. Simply put, the COVID-19 vaccine can save your life and the lives of your friends and family.
And I asked certain questions. Is she in pain? Could she come back? And they said it was nothing like that. They said it was either, I asked them to be straight.
To be real with you.
To be real, I'm a realist. And they said, hours, days, 1 week. So I gave myself some time, and then I had a family discussion with those at home.
How was that for you to relate to your children?
You see, my children did not lose a mother, especially my daughter. She lost her best friend.
Wow.
Sure. Was she in ICU? Was she in ICU at all, or it just happened? She was on a ward.
She was on a ward.
So you weren't expecting it at all.
No.
It wasn't the normal. You know, they usually talk about the ICU beds right now. Rome, this was normal in the ward, and then suddenly she had a stroke. Yeah. But I know that, I'm sure they told you that with COVID, you're more prone to strokes. Yeah.
Was what they said is that she had a lot of blood clots in the brain.
Yeah.
So
JP, this one is for you in terms of, he's mentioning she had a lot of blood clots. Is it that the COVID-19 virus itself
It does.
cause blood clots?
It does. It makes your clotting mechanism all screwed up. So you either bleed a little bit or get clots, mostly clots. So you're more prone to having a clot in the lung or a stroke or a heart attack even. And so it's not surprising that, that this happened. Yeah.
Did you get the chance to say goodbye?
never did.
That break my heart, boy. How many years you all were married for?
This year would have been 33 years.
So 33 years of marriage, and
We met at 19, started to live at 20, and got married at 21.
so that was the love of your life.
That is the only love I knew.
Yeah.
So when's the last time you spoke to her then? Because you said the Saturday was...
The Sunday was the 16th of May. That is when they went to the 2 supermarkets in Central.
Right. For you. Essentially for you.
Well,
So
the
her last
16th
thing
of
was
May,
doing something for you, right?
Right.
Yeah.
Was for my birthday. My birthday is the 16th of May. From the Tuesday, because the 16th of May was a Sunday, from the Tuesday, Wednesday, they decided to get flu-like symptoms, and they weren't eating. And we kept them there until the Sunday we decided it's too long. Let's take them to the health facilities, which we did, sugar on us, and they kept them. The Monday they called us and tell us COVID positive. We have to go into quarantine. Initial diagnosis of my son is that he has the kidneys not working and he need to dialyze almost immediately. With my wife, they said her symptoms were all over the place and they cannot get her to pinpoint it.
Right. Was it probably clots too, eh? The clots were affecting everything. So multi-system, yeah.
And a lot of people at home would have heard about the COVID-19 deaths. Every day we're hearing about people dying from COVID-19. And some people are basically getting even numb to the numbers because it's a number. But why I'm glad that we have you here is that it's personal. This is a person. This is not number 11 for the day or number 9 for the day. This was your wife. This was the love of your life. This was your children's mother. This is a person, and why we wanted to speak to you again is to show people how real this is in terms of these are actual people. These are not figures that we're dealing with. Talking about, okay, you lost your wife. Were you all allowed to have a funeral, a normal funeral, seeing that it was COVID-19? What was that like, that experience like?
Well, because we were under quarantine, and we were under quarantine for 21 days, I was looking for closure for the kids. So they did Zoom for us at home. My son was at the hospital still, Arima. So he watched it on his tablet. And we were at home and we watched it at home.
So you all had to witness a funeral via Zoom?
Yeah.
So you still didn't, even though you didn't get to tell her goodbye in person or even a phone call, you still couldn't even get to view the body?
No. The last time I spoke to her, well, when I came to drop off back to them at the Shogunas Health Facility, was Tuesday, and she was, the last thing was, she was telling the nurse, I'm hearing my husband's voice. Could I see him, please? And I was standing right next to her. Because they allowed me just to come in and drop the bag, don't touch anything.
Right.
But I was right next to her and she wasn't.
I mean, she's, as you said, God knows best and she's in a better place now. But if you had final words that you could have said to her before she left, what do you think you would have said? If she's listening at this
Well,
point?
she is listening now.
Right.
And continue to love you, take care of your kids and your grandkids.
And
Thanks for being part of my life.
touching JP.
Mindfulness minutes, we'll go to it.
Yeah, time for us
I
to
don't want
go
you to
to,
say anything. No. Yeah,
a mindfulness moment. Let's just take a deep breath and we will come back and speak a bit more with Mr. Cumberbatch.
Hello and welcome to your mindful moment. Today we're going to explore mindfulness and the breath. So our breathing is a really powerful anchor for us to use to keep us focused in the current moment. We often breathe unconsciously and we don't think about it because it happens all along in the background. But we can use our breathing to send a really powerful signal to our nervous system to tell us when we need to calm and when we need to focus in the current moment. So let's practice that now. I'm going to invite you to get into your mindful bodies, your spine straight. And just take a minute or two just to let your breathing settle in. To feel your body seated where it is. And let your emotions settle. And together we're going to take a deep breath in. Good. And out. You might find it comfortable to put a hand over a part of your body where you can easily feel your breath. For instance, over your tummy or over your chest. And you're just going to feel, in my case, your belly rise and fall as you breathe in and out. Keep practicing using your breathing and remember to be here now.
It's Rome, and we are here. We're chilling with the boys. We're liming with the kids. We're doing this all for the PED Cares Foundation. So we need you at home watching us to go donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yeah. 1, 2, 3. Yay! The PED Cares Foundation. All right, so we are back. We are here with Mr. Cumberbatch, who is giving us the reality of it. Yep. And I want to thank you very much for opening up with us and sharing, because I know this has been difficult. I mean, it's been a difficult time for your entire family. How has that been affecting your life since then? You get back home, you're allowed, you could sleep as usual. How is it?
It's a bit difficult in the sleeping department because sometimes when I reach back home from work, because I resume work, first couple hours, and then from 1, 2, I'm up.
So what do you think about though when you're up like that? What comes to mind?
My wife.
Just thinking about the whole night?
Thinking about her, thinking about not having to actually tell her goodbye. And just thinking.
Yeah.
How is it at work? As you being a sergeant, I say sergeant, you would
supervisor. As an estate sergeant, you are a supervisor.
Right. Has COVID affected your job at all?
Yes, it has.
Yeah.
The whole dynamics have changed. We have lost some of my co-supervisors due to COVID.
So in your company, I think your boss, your actual direct boss also
Yeah,
died.
my
of
one-up.
COVID. Yeah.
He passed away from COVID.
Passed away from COVID.
Yeah.
So you have been seeing this thing at home, in work, and through all of this, you have been exposed to it at work, you have been exposed to it at home. Have you contracted the virus at all?
Never.
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 You're definitely blessed. And that leads me to ask, have you been vaccinated?
Fully vaccinated.
So you have been vaccinated. So seeing that your wife and your son and some of your children contracted the virus, and you didn't contract the virus, then why go get vaccinated? Didn't you feel as though you were immune to the virus?
No.
So what was your reasoning behind getting vaccinated?
I needed a fighting chance because now more than ever, I need to be there for my family. People look at it as the social media doctors. I don't believe in the social media doctors. I believe in Dr. Paul and the real doctors. I believe in having a fighting chance against this disease because it came home. A boxer uses her gloves, not because he wouldn't feel the effect of the punch, but it will cut down on him getting cut.
Right.
I need a glove. The glove was my vaccine. If I could just go back in time, my wife and my family would have been first in line to get vaccinated. It wasn't meant to be. I was meant to be here to encourage my fellow Trinbagonians, go and get vaccinated, please.
So you would advise people
Straight up, please.
so that they wouldn't have to go through what you and your family was raised with this episode, because I could feel it. I could feel his energy. I could feel that you and your family would definitely miss your wife. And to those of you out there who still have doubt and you're becoming numb, as I said before, of hearing how many people contracted the virus and how many people are dying, and it's just a statistic to you. You could see here that this is not a statistic. These are real people with real lives, with real families. And as you said, if you think if your wife was here now and she had that opportunity to take the vaccine, that she would have?
She most definitely would have.
So you said that you stay up at night to tell her goodbye, right? Because you never got a chance to tell her goodbye. You want to tell her goodbye now?
I have been telling her that since.
Right.
And I take every opportunity, not only to tell her goodbye, but to tell her thanks
Right.
for allowing me to be a part of her life for 30 odd years.
Okay.
How are the children coping?
They have their moments, but they tend to be trying to be as active as possible.
Right.
Church is a major part of it. Thanks. Churches are open back, so they are back out of church.
Right. And your son, you were saying he has kidney failure. So that's part of the long COVID. People forget about the effects of COVID afterwards, Rome. So sometimes you might have lungs, you might have kidneys affected. It's the same COVID, eh? It affects the multi-system. So he has kidney failure and they're not sure when it will recover, right?
No, he dialyzes 3 times a week,
Right.
and he is improving.
Right.
And praise God that we are seeing a light at the end of the tunnel, because he's getting stronger, he's getting, his body functions are improving, and
And how old is he?
he's 30. He'll be 31 next
He's
month.
30,
That's
yeah,
young, because
30
normally
years old.
people would say that COVID would affect
Yeah.
the older people and the elderly.
No.
And he's 30 years
Yeah,
old.
30
He's younger
years
than
old.
I am.
Yeah.
And he has renal failure. So, Mr. Kamabach, again, condolences to you and your family, your
you,
wife.
sir.
We know that she loves you all and she's hearing you all and she's in a better place. And thank you very much for sharing all of these
The
things
pleasure
with
was
us.
mine to be here to share with you, Dr. Paul. Thank you.
Thanks for coming.
Thanks, JP.
Definitely.
Guys, we want to remind you all to go across to pedcares.org and keep on donating as we help our kids to get the best care that they could possibly get. Again, thanks to our friends at Dwellings for this beautiful set. Thank you very much for joining us right here on Homefront. My name is Rome. much. Nice to meet you.